Hey, it's good to see y'all. I'm coming here today with Miss Kim, and we're going to talk about medical missions. And so I'm kind of excited about this because I've seen pictures of things that they've gone to do and everything. And if you are considering doing medical missions or any kind of missions work, going with the group or whatever, I encourage you to really pray about it. And it's a good thing. And I've got Miss Kim, she's gone on two of them, right?
Three.
Three already. Okay. So I'm going to
Yeah.
let her talk a little bit about it.
Okay. Well, thank you for giving me this opportunity
Mm-hmm.
to share my experience. So, just a little bit of background. I graduated from Pensacola Christian College in 1988
Mm-hmm.
with a Bachelor of Science degree in nursing. And I have been working consistently since that time. So, I've been a nurse for 37 years.
Oh, that's good.
And 27 of that has been in the NICU. And
Oh,
then the the other 10 was kind of sandwiched in the middle there. I did outpatient surgery and PACU, which is the recovery room.
mm,
And so I always grew up and was in mission minded churches. I've seen many mission presentations
mm-hmm.
through my life. And um, I never felt called myself to go to
Mm-hmm.
the mission field, not even remotely. But I supported missions by giving.
Right.
And uh, after I got married, we gave to missions through our church. And it just amazed me some of the hardship that these missionaries would go through. Not even the sacrifice they made on the mission field itself, but just trying to get through deputation,
Yeah.
traveling around constantly for sometimes over 2 years,
Right.
and dragging their children and sleeping in other people's homes, constantly being under the microscope for your
Yeah.
behavior and appearance. And I thought, we would never pass that test. It was just, there was just no way we would ever pass that test. So, but like I said, neither one of us felt any call to the mission field at all.
Right.
So in 2000, we had adopted a little boy from Guatemala.
Yeah.
He was a baby. And we always thought it would be neat to take him back to Guatemala when he was older to give him a chance to see his birth country.
Right.
So in 2018, my husband had a job that he traveled a lot. So he did a lot of airline flying and then
Right.
staying in hotels. So he had all these points built up for airlines and hotels. And he decided that we would go to Guatemala for a family vacation and take our son to see his country. And um, so the trip was essentially paid for, except for our food and
Right.
transportation within the country. My son ended up not going, and we have an
Oh.
older son. He didn't want to go either, so it was just my husband and I and the three girls, and it was so beautiful. It was so the climate just it's just one. It's like paradise.
Yeah.
I loved it, and I thought, well, since we're going down there, why don't we try to hook up with a missionary that's down there and kind of
Right.
look at their ministry. And so we got a hold of Carlos and Jamie Donate,
Mm-hmm.
and they have a church that they've started in Guatemala City. And they have a lot of ministries through that church. So the pastor is also a physician as well.
Oh, that's good.
So he had like a clinic through the church, and it wasn't something that was open all the time, but it was as needed.
Right.
He would see people. He also had a deaf ministry,
Oh, wow.
which my oldest daughter and I were pretty interested in. And because he was a physician, he had contact with the local public hospital. Unfortunately, he had an adult son in ICU at that time as well, so he
Yeah.
was in and out of the hospital for that reason. And he was able to get me a tour of their NICU.
Oh, neat.
And they were very receptive to me. They allowed me a tour. They talked with
Wow.
me. Um, I had taken down this huge stuffed garbage bag full of like knitted and crocheted baby hats,
Right.
and they were sizes all the way from tiny preemie up to, probably like a 3 month size. Just
Okay.
a variety of hats, and they were beautiful. I mean, absolutely beautiful. And they were donated to the NICU that I worked at in San Antonio,
Right.
but we were not allowed to use anything with yarn.
Oh,
So they just sat there and nobody could use them.
right.
So when I was going to Guatemala, I asked the management, "Do you want me to take these?" And they were like, "Yes, take them, get them out of here."
Yeah.
So the people there, there wasn't a lot of moms that I was able to talk to in the NICU at that time.
Yeah.
But they did tell me that the parents are required to provide a hat. The
Oh,
baby always has to have a hat in their NICU. And so if the parents don't have one, they have to go buy one and
right.
bring it in. So they said this was wonderful because then the parents would not be forced to have to go buy a hat. They'd have one.
Oh, that's amazing.
Yeah, and it was such a wonderful and receptive experience. I got to thinking how easy that was. And I didn't have any tracks or anything to pass out at that time.
Right.
So I thought, what if I came back with something for the baby and we were also able to give like a track at the same time? So in October of that year, I went back by myself. Not just, it was a very quick trip, like traveled out one day, stay
Yeah.
one day, and come. I was in 3 days, I made the trip.
Oh, cool.
And so the one day I was there, the missionary took me back to the NICU. I took with me, I had gone to thrift stores and bought baby shirts, like
Mm-hmm.
onesies,
Yeah.
that were on sale, that they looked really clean, um, basically almost new.
Yeah.
And I took several sizes down there from preemie to 6 months. We put each one in like a little bag with a track,
Oh, that's cool.
and we went to pass them out. And so there was a group of moms there at that time holding their tiny babies, and the NICU there let me have like a little bit of time with this group of moms.
Wow.
Um, the missionary interpreted for me,
That's good.
and I was able to explain, kind of show them that I'm giving this gift to them,
Right.
and so salvation through Jesus Christ is also a gift. So I was
Right.
able to kind of like show them that way, um, how it's a gift, it's not earned.
Right.
I felt it was very successful, and I really had planned to go back within the next year
Yeah.
and kind of do the same thing. I was not able to make that trip, and then COVID hit the following year.
Right.
So in about 2019, my pastor's wife, who was also a nurse,
Right.
had been going on some medical mission trips. And so I just kind of started talking to her, like, what, how did you do that? How did you sign up, or who did you
Right.
go with? And she told me that she went through a couple of different organizations. One was Medical Mission Outreach, and one was Truth for Today Missions.
And if y'all need those, we can probably have those up on the website. I'll ask my husband to look those up in case we're getting in a hold of people.
So I started doing a little bit of research. I chose a mission trip through Medical Mission Outreach,
Mm-hmm.
and we went in July of 2021.
Oh, wow.
Um, it was it was a phenomenal trip. I didn't know what to expect, but they treat the guest missionaries very well. They always go through a local church
Right.
within the country. Most of the churches are probably missionary begun, but they always go through a local church, and that church is responsible for all the transportation. They're responsible to organize the hotels, all the food. the clean water, a place for us to have clinic. It's a big deal. But the
Yeah.
churches want us to come because that's a way to get the people to come to the church.
Right.
Where they wouldn't come for a service, they'll come to get medical treatment.
Right.
So it's a great tool to get the gospel out, and that's
Yeah.
what it's used at. Is we use it as a tool, and so um, this first trip was Matagalpa in Nicaragua. It was up in the mountains, so it was at a nice elevation. We weren't too hot. Um, we were in the middle of a rainforest, and it was rainy season.
And you got to see a sloth. Was that the one with the sloth?
Yes, that was
Oh,
the
that
one
was
with
so
the
cool.
sloth. So we had so much mud. There was mud everywhere. And one day you just heard like a bunch of squealing and screaming, and I was looking to see what was going on, and everybody's like running down the path because there's a sloth
Yeah.
moving across the path, and he had moldy fur. I just remember green moldy fur. It's like, ah. But anyway, everybody thinks that a sloth moves pretty slow,
Yeah.
and he was kind of moving slow until he saw everybody running after him, and then he moved pretty fast
Oh,
actually to get up
wow.
in the tree.
That's funny.
He can move fast if he wants to. So that was a big deal, taking pictures of the sloth. It was an open air clinic, so we had dogs wandering in and laying down, and
Yeah.
you look out on the road by the clinic, and there's somebody leading their cows down the road, and
It's not the normal clinic that
yeah,
you
it's
go
not
and
the
it's
normal
enclosed and everything
clinic.
like that. But it did have a lot of organization.
It
I
did.
did
I
notice
was
through some of the pictures that you had
I
had.
was actually surprised
Yeah.
at how organized it was, and one of the main leaders of the organization, he and his wife were there for that trip,
That's good.
and he was very detail oriented and just, I mean, everything was just worked out so well. Um, and so it was a great experience. At that particular clinic, I was designated as a provider,
Hmm.
which means I was basically treated like a doctor or a nurse practitioner or something
Right.
like that. Uh, so I had to listen to the patients and then basically kind of prescribe the medication or the treatment that I wanted them to have. So this is really out of my scope of practice.
Right.
I have no training in that whatsoever. Just basically from general knowledge.
Yeah.
And so that was a little bit of a challenge for me to kind of be thrown into that. So I made myself sit right next to the doctor that was on
Good
the trip.
idea.
So if I had
Pick his brain.
so if I had a question, I just asked him, or a lot of times the more complicated patients, I would just pass on to
Right.
him. I would
To
say,
him,
I
let
want
him
you
have
to,
it.
yeah. I would ask, can you just take care of this? And so it was a little, basically the medications that we take are all over the counter. There
Right.
are a few prescription type things like some steroids, antibiotics. We have also like some blood pressure medication, but everything else is pretty much over the counter.
And y'all can get donations for the over the counter stuff as well.
Yes,
Unopened, unused,
and unexpired.
and
It
unexpired.
has to, it cannot be expired.
They won't let it in the country
Right.
if it's expired, I'm pretty
Correct.
sure. And is there a certain amount? There's not a certain amount that y'all have to go by to declare, since y'all are going on the medical missions, right? On the over the counter stuff.
No,
okay.
I'm not sure how they handle that through customs.
Yeah. But
Um,
you can go through the medical missions site as well, right?
yes,
And
yeah.
just contact them and say, look, I have these to donate, and they would love to have that. I know our
Yeah.
church had collected some.
Right. I got a box from the
Yeah.
church. As I went through it, most half of it was expired, so I
Oh,
couldn't
no.
send it. But the ones that weren't expired, I did ship
Oh,
on.
good. So
to-
reminder is not expired. Make sure they're not expired.
Yeah.
So that's a good thing.
So
and-
the very
go ahead.
first patient that they brought to me was a baby, and his head was as big as a basketball,
Oh,
and
no.
his little body was maybe the size of a 9-month-old, and he had hydrocephalus, and
Yeah.
he'd had it since he was born. You could feel the shunt that they had put in to drain the fluid from the brain down into the abdomen. So
Right.
we could feel it, but obviously it wasn't
Wasn't working.
working. But the mom didn't bring the baby for that reason. She brought the baby because he was constipated. And so
Hmm.
the mom was all concerned about the constipation, and I'm looking at this head like we have a bigger problem here.
Yeah.
So it it turned out that the baby's doctor had wanted him to gain more weight, so he had told her to put rice cereal in with the
Oh,
milk, but she was putting too
too
much.
much of it.
And so she was like, "Well, the doctor keeps telling me he wants him to gain weight." And but it was just way too much rice cereal, and that's what was causing the constipation. So I was able to explain that to her. But then the doctor and I both were kind of
Taken back for it.
for
Yeah.
the head. What are we going to do about this? And it turned out she had said that the physician that put the shunt in told her not to come back till the child was 7. And
That's a long time to wait.
it for a child that's growing, it's absurd.
Yeah.
So we sent her to Managua. Actually, somebody drove her down to Managua, which is a couple hours away,
Yeah.
and said, "You need to go
Excuse me.
back to the baby's doctor, walk in and say, we need help."
Right.
And so they were able to take her back to
Oh,
that
that's good.
physician. And then before we left, we knew the child was back in the hospital,
Oh, good.
hopefully to get that fixed.
Yeah, that's kind of crazy that, unfortunately get told not to come back till 7, but then it's messing up. Obviously, it's not
Right, it's
working
not
right.
working.
Something's stopped up or something. And that's
Mhm.
pretty neat. And with the organization you were talking, um, did y'all have, or was everybody medical, or
No,
did you have
I
other
mean,
people?
we had an eye clinic at that um, time as well.
Right.
So people could come for medical or they could come for eye. And the organization takes hundreds and hundreds of glasses down every trip, so that we can kind of get the closest prescription to
Right.
whatever anybody needs. And they handle reading glasses, and then they also handle regular um, long long distance
Right.
vision as well. Um, Sometimes we also have dental and physical therapy.
Oh, that's good.
Some of the trips do, not all of them. So dental is a big draw as well.
Right.
The physical therapy, people can't really just come in for physical therapy. They have to be seen by one of the providers first, and then that provider will decide if they need physical therapy.
I'm gonna stop us. It's our time is up right now. But we're gonna come back for part 2 in just a minute, if that's okay with everybody. And we do encourage you. I do want to talk more about this because I'm a little intrigued, about having the other people that are going. But this is just part 1. We're gonna come back with part 2 in just a minute. And remember, it's important to know Jesus as your Lord and Savior, and going through all of this and giving the tracks out and helped out and knowing that He's there to protect you. So I encourage you to get in your Bible, and if you don't have one, contact us. We'll get you a Bible. If you have any questions, contact us. But stay tuned for part 2.